Today, whenever you experience a severe toothache or physical ailment, you simply walk into a clean medical clinic. The doctor seats you in a comfortable padded chair, administers a quick numbing shot or places a mask over your face, and within minutes, all sensation of pain completely vanishes. You close your eyes, relax, and your treatment is completed seamlessly without a single moment of agony. But have you ever wondered how early humans, living in caves and surviving in the wild thousands of years ago, faced this exact same unbearable pain? Picture an era when the Earth had no hospitals, no trained doctors, no antibiotics, and not a single drop of pain-relieving medicine. In those prehistoric times, if an early human developed a rotting tooth or suffered a crushed bone from a wild animal attack, what options did they truly have to escape the suffering? We all know how excruciating a toothache can be. Modern archaeologists studying ancient human skulls have uncovered a chilling reality about the prehistoric world. When an early human suffered from severe tooth decay, they didn't have access to modern dental drills. Instead, they relied on crude, razor-sharp tools crafted from flint stones. Members of the tribe would forcefully pin the suffering individual to the ground so they couldn't move. Another person would then take a pointed stone tool and manually twist and drill directly into the center of the rotting tooth to release the pressure and decay trapped inside. Imagine having a sharp stone scraped into the raw nerve of your tooth while fully conscious. The sheer thought of it sends shivers down the spine. If a tooth had to be extracted entirely, it was knocked out using stone hammers or pried loose with wooden levers. Even more terrifying were their primitive brain procedures, known today as trepanation. When an early human suffered a severe head injury or relentless internal pain, tribes believed that an evil spirit or immense pressure was trapped inside the skull. To release it, they would force the person onto the ground, slice open the scalp using jagged obsidian stones, and slowly scrape away at the skull bone until a hole was worn completely through. Yes, a living, fully conscious human had their skull scraped open with rough stones. The individual would scream and writhe in agony, but the tribe held them down until the procedure was complete. Remarkably, scientific studies of ancient skulls reveal that many individuals actually survived this harrowing ordeal, as evidenced by healed bone tissue around the drilled holes. If an arm or leg was crushed during a hunt and began to rot, there were no surgical saws available. They used sharp stone blades to cut through living flesh and muscle. But the most horrific part came next. To stop the profuse bleeding and close the wound, they applied burning wooden embers or red-hot stones directly on the raw flesh. Cauterizing the tissue with open fire was their only method to seal blood vessels and prevent immediate death. They had no modern painkillers to numb the agony. They chewed on bitter wild leaves, tree bark, or natural roots, but these offered minimal relief. Their only true defense was raw human endurance, willpower, and the firm grip of their fellow tribesmen holding them down. Today, as we sit comfortably in sterile hospital rooms receiving pain-free care, it is easy to take these advancements for granted. Yet thousands of years ago, our ancestors endured unimaginable suffering among stones, fire, and raw agony just to survive. The painless medical care we enjoy today is truly one of humanity's greatest miracles, a mercy that early humans could only pray to the heavens for.